12 meridians and 8 extraordinary meridians in Chinese medical treatment. Interesting TCM and acupuncture. Lecture 17. The foot Greater Yin spleen meridian, hand Lesser Yin heart meridian, and hand Greater Yang small intestine meridian. Contents. The foot Greater Yin spleen meridian. The hand Lesser Yin heart meridian. The hand Greater Yang small intestine meridian. Part 4. The foot Greater Yin spleen meridian. Foot Greater Yin spleen meridian. Name, circulation, disease, acupoints, and treatments. Name. The hand and foot, yin and yang, and the organs are how the naming convention is established for all meridians of the 12 upright meridians. The foot Greater Yin spleen meridian arises from the large toe, moves up the interior ankle, passes the interior of the lower leg, and along the abdomen and chest. Because it is the innermost of the 3 meridians, it's called Greater Yin. It belongs to the spleen, and its special feature is that it has less blood and more qi. Circulation of the foot Greater Yin spleen meridian. The Spiritual Pivot, Meridians and Vessels chapter says, the foot Greater Yin meridian rises from the tip of the great toe. It circulates interiorly on the corner of the light-colored flesh. After it passes the bones of the feet, it rises in front of the ankle, passing above the leg, and after circulating past the bone of the lower leg, it meets and passes the terminal yin. It rises up the inner front of the thigh, enters the abdomen. It belongs to the spleen. Its collateral is the stomach. It rises to the diaphragm, passing the throat, and moving to the root of the tongue. It scatters under the tongue. Its branch returns and connects to the stomach, passes the diaphragm, and rests in the heart center. The great collateral of the spleen is called the Dabao point. It emerges 3 tun beneath the axilla and resides on the side of the chest. Explanation of the above text. It follows the leg from its point of entry on the great toe on the in-bai acupoint, and then follows along the margin of the foot, along the lighter colored skin there. Then it rises and passes along the anterior inner ankle, moving along the central portion of the interior leg. Roughly 8 tun above the inner heel, it passes the foot terminal yin liver meridian and moves to the inner thigh in the anterior position. It enters the abdomen and spleen, but also connects to the stomach. Then it passes the diaphragm and the esophagus, connecting to the root of the tongue and scattering beneath the tongue. The meridian also has a branch which leaves the stomach and rises to the diaphragm, resting in the heart center, meeting the hand Lesser Yin meridian of the heart. Foot Greater Yin spleen meridian illnesses. The Spiritual Pivot Meridian Vessels chapter says, the Greater Yin spleen meridian of the foot, when moving in illness, will cause the roof of the tongue to become stiff. If eating, there will be vomiting. The upper abdomen and stomach will be sore. The abdomen will distend. The patient will belch frequently. After this, their qi will rapidly decline, and the whole body will become heavy. Illnesses of the spleen include painful tongue root, inability to move the body, inability to keep food down, heart vexation, acute pain under the heart, pooling obstruction of the intestine leading to leakage, water retention, jaundice, inability to lie down, extreme stiffness, swollen knee and leg with flaccidity, inability to use the great toe. Explanation of the text. This channel's illnesses are characterized as vomiting, stomach ache, distension of the abdomen, heart vexation, jaundice, stomach forming a hard nodule, loose stool. The spleen meridian performs the function of transport and transformation. So when it loses this function, the spleen cannot do these things. The spleen is the root of the post-heaven and controls digestion, meaning that it transforms the qi of food and transforms it into blood. If the spleen meridian has a problem, it will result in abdominal swelling, loose stool, dysentery, stomach pain, sighing, and lack of strength. Aside from this, the tongue root will become stiff and sore, the lower limbs will become inflamed, and this will show that the meridian has lost its normal function. Acupoints of this meridian. The acupoints of this meridian start on the big toe and continue on the inner ankle, lower leg anterior portion, and then also express themselves on the abdomen and chest in the interior third. They rise from yin bai at the end of the da bao, left and right, and each have 21 points for a total of 42. The order is yin bai, da du, tai bai, gong sun, shang qiu, san yin jiao, lou gu, di ji, yin ling chuan, shui hai, ji men, chong men, fu she, fu jie, da heng, fu ai, shi dou, tian xi, xiong xiang, zhou rong, and the meridian ends in da bao. Special points. The 5 transfer points are yin bai, which is the wood and jing well point, da du, tai bai, shang qiu, yin ling chuan. The yuan source point is tai bai, which is also the shu stream point of the spleen meridian. The collateral points and 8 vessel meeting point is gong sun. The shi cleft point is di ji. The great collateral is da bao. This meridian treats diseases of the spleen and stomach, gynecological illness, illnesses of the genitals, illnesses of the meridian. If the stomach is sore, food cannot be kept down. The abdomen is distended. There is loose stool. The limbs hang down without strength. The tongue root is stiff and sore. The lower limbs become swollen. Flaccidity occurs, and loss of use of the big toe. 5. The hand lesser yin heart meridian. The hand lesser yin heart meridian, its name, circulation, illnesses, points, and treatment. Name. The hands and feet, yin and yang, and organs and viscera make up the 3 parts of the name. The hand lesser yin heart meridian rises from the center of the axillary cavity in the Jichuan point and follows the inner aspect of the upper arm. It is called lesser yin and is associated with the heart. Its specialization is that there is less blood and more qi. Hand lesser yin heart meridian circulation. The spiritual pivot meridian and vessels chapter says, the heart lesser yin meridian of the hand rises from the center of the heart and is associated with the heart. It travels to the diaphragm and its collateral is the small intestine. It has a branch which follows from the heart and travels to the throat, attaching to the eye. It travels directly from the heart, rising above the lung and going below the axilla. It then moves down the arm interior in between the greater yin and terminal yin meridians of the arm and passes down the center of the elbow. It passes to the forearm, to the palm, and then passes to the tip of the small finger in its interior aspect. Explanation of the above document. This meridian travels directly from the heart and is attached to the heart, as well as the vessels surrounding, and then proceeds to the diaphragm and connects to the small intestine. It has a branch which travels upward to the esophagus and connects to the eye and its relevant neurological infrastructure. It also travels outward on the trunk, passing the lung, and emerging at its first point, Jichuan, in the axillary cavity. Then it circulates down the interior of the arm between the greater yin and terminal yin meridians, passing the elbow at the Shaohai point, passing the forearm and arriving at the hand on the juncture of the wrist, at the Shenmen point, entering the hand and ending the inner tip of the little finger at the Shaozi point. Its qi connects with the greater yang meridian of the small intestine. The lesser yin heart meridian of the hand illnesses. The spiritual pivot meridians and vessels chapter says, when it moves in pathogenicity, the throat becomes dry, the heart painful, there's thirst with desire to drink, and the arms become paralyzed. The illnesses of the heart are yellow eyes, painful sides, inner arm pain, flaccidity, and heat in the palm center. Explanation of the above text. When this meridian experiences pathogenic change, it expresses itself in the following illnesses: dry throat, heart pain, dry mouth with desire to drink, pain in the front of the shoulder due to qi stasis, flaccid cold, various types of pain. The meridian points of the heart can be used to treat these illnesses, including clouded eyes with yellow sclera, numbness, painful sides, upper and arm interior pain, flaccid cold, heat in the palms, and obvious impediment of the meridian. Points of the meridian. The heart meridian has 9 points. Each of these points are on the arm, and 1 point is in the axillary cavity center. It arises at Jichuan and passes to Qingling, Shaohai, Tongli, Yinxi, Shenmen, Shaofu, and Shaochong. Special points. The 5 transfer points are Shaochong, which is the Jingwell and Wood point, Shaofu, Shenmen, Lingdao, Shaohai. The Yuan source point is Shenmen, also the Shoestream point. The collateral point is Tongli, and the Shi cleft point is Yinxi. The meridian treats. The heart meridian, the heart, chest, psychological problems, and problems of the meridian. Heart illnesses may be treated with Jichuan, Yinxi, and Shenmen. Psychological issues may be treated with Shenmen, Shaochong. Problems of the tongue and throat can be treated with Tongli and Yinxi. Problems of the blood may be treated with Yinxi. Problems of the upper limb with pain leading to numbness may be treated with Jichuan, Qingling, Shaohai, and Lingdao. Avoid the axillary artery when using acupuncture on Jichuan. 6. The hand greater yang small intestine meridian. Name. The hands and feet, yin and yang, and organs of the viscera make up the 3 parts of the name. The meridian starts at the little finger. It travels along the upper arm. It's distributed on the ulnar side of the little finger of the hand, the outer posterior edge of the upper limbs, the back of the shoulder, and the scapula, the neck, the cheeks, the external canthus, the ears, and the internal canthus, to meet with the greater yang bladder meridian. It's called the greater yang, is associated with the small intestine. Its specialization is that it has little qi and much blood. Hand greater yang small intestine meridian. The spiritual pivot meridians and vessels. The small intestine greater yang meridian of the hand rises in the tip of the little finger. It circulates on the palms and passes the wrist. Then it travels directly to the forearm. Then it passes the elbow between the 2 bones. It follows the outside of the upper arm. It passes the shoulder. Then it travels around the shoulder and upper back, entering the chui pen. It connects to the heart and passes the throat. Then it descends to the diaphragm, entering the stomach, and connects to the small intestine. It has a branch which moves up the neck, arrives in the eyes at the canthus, and then it enters the ear. Another branch leaves at the cheek and moves to the mouth, arriving at the eyes and inner canthus. Explanation of the above text. The hand greater yang small intestine meridian starts at the outer tip of the little finger at the Shaozi point. It passes the palms and rises along the ulna. It passes the forearms and passes the outer elbow at the Xiaohai point. It moves up to the upper arm on the outer side, traveling past the shoulder joint. It passes the shoulder and spine and dajui and meets the Du meridian there. It travels to the front of the neck at the Chui pen. Then it deeply enters the body cavity and connects to the heart. It passes the esophagus and penetrates the diaphragm and enters the stomach. And then it enters the small intestine. It has a branch which enters the clavicle and passes along the nape and neck, arriving at the corner of the eyes. Then it returns to the ear center front at Tinggong. Aside from that, there is 1 branch vessel that leaves the cheek and passes down the eye socket. Then it penetrates the nose root and enters the inner canthus. Then it passes the cheekbone at Chuanliao. The vessel qi meets with the foot taiyang bladder meridian. It also meets with the hand shaoyang heart meridian at the little finger. Below it meets with the greater yang bladder meridian of the foot at the inner eye. The spiritual Hen Greater Yang small intestine meridian illnesses. The spiritual pivot meridian and vessel chapter says, when it moves and becomes ill, the throat becomes sore, the chin becomes swollen, the shoulder is injured, the arm breaks. Its illnesses are deafness, yellow eyes, swollen cheeks, nape, shoulder, arm, and elbow pain on the external aspect. Explanation of the text. The small intestine meridian expresses the following illnesses: throat pain, swelling under the chin, shoulder separation pain, upper arm pain as if broken. The points of the meridian treat yet fluid illnesses: deafness, yellowing of the sclera, swollen nape, neck, shoulder blade, chin, upper arm, and front arm exterior pain, as well as loss of the function of the channel. 6.4 Meridian Points. The meridian has 19 points. It begins with Shaoze and ends at Tiangong. 8 points are on the upper arm and 11 are on the shoulder, nape, and head. They are Xiaochang, Qiangu, Houxi, Wangu, Yanggu, Yanglao, Zhizheng, Xiaohai, Jianzhan, Naoshu, Tianzong, Bingfeng, Chuyuan, Jianwai, Jianwaishu, Jianzhongshu, Tianchuang, Tianrong, Chuanliao, and Tiangong. Special points. The 5 transfer points are Shaoze, which is the Jingwell point and metal point, Qiangu, Houxi, Yanggu, Xiaohai. The Yuan source point is Wangu. The collateral point is Zhizheng. The Shi cleft point is Yanlao. Treatment. It treats head, nape, ear, eye, and throat and heat illnesses, as well as psychological disorders. For tooth pain, use Tinggong Chuanliao. For eye diseases, use Houxi and Yanglao. For ear illnesses, use Tinggong, Houxi, and Qiangu. For throat illnesses, use Shaoze, Qiangu, Tianchuang, and Tianrong. For head and nape pain, use Houxi, Yanglao, Zhizheng, Tianchuang, and Tianrong. For breast pain, use Shaoze and Tianzong. For acute waist pain, use Houxi and Yanglao. For shoulder pain, use Houxi, Yanglao, Zhizheng, Jianzhan, Naoshu, Tianzong, Bingfeng, Chuyuan, Jianwaishu, and Jianzhongshu. Attention should be paid to angle and depth in needling acupuncture points on the back and neck. To pierce Tinggong, the patient should open their mouth and needle should be inserted straight. Thank you for watching.